Welcome to This Explainer. Look, you already know how to be an incredible registered nurse, right? I mean, you've spent years mastering your clinical expertise. You know the exact nuances of patient care, and you operate on the floor with this total unshakable confidence. You know exactly what to do in a code, you know how to talk to stressed families, and you are a fierce advocate for your patients. But suddenly, you're placed in front of a classroom of adult learners, and the rules just completely change. Because, as it turns out, the skills that make you a phenomenal nurse do not automatically make you a phenomenal teacher. So today, our core focus is going to be entirely different from clinical practice. We are going to break down the fundamental mindset shift required to transition from a practicing RN into an effective, deeply engaging healthcare instructor. We aren't teaching you nursing today, we're exploring the science and really the vital art of teaching adults. Here is our roadmap for today. We'll be starting with the adult learner experience, then moving on to pedagogy versus andragogy, exploring the characteristics of adult learners, looking at the factors affecting adult learning, and finally, we'll wrap up with building psychological safety. Okay, let's dive right into section 1, the adult learner experience. And we're going to start by looking at the classroom through the profoundly vulnerable eyes of the learners themselves. This is such a powerful confession. It actually comes from an adult literacy student featured in our sources. I want you to just imagine this for a second. The man in our sources spent 15 years carrying a briefcase to work every single day. He'd sit at his desk, he'd fake the paperwork, and he'd pretend to read. Why? Because the sheer crushing shame of his academic struggle forced him into hiding. He was fully capable of the labor, fully capable of showing up and working hard, but asking for help, that felt like a fate worse than death. And listen, this is the exact same terrifying vulnerability your students might be feeling right now in your lab. Let's create a hypothetical student. We'll call her Sarah. She's 40, she's a mother of 2, she's returning to school after 15 years, and she's sitting right there in your CNA lab. If she doesn't understand how to listen for a systolic pressure on a manual cuff, her first instinct is not going to be to boldly raise her hand. No way. Her instinct will be to hide, just like that man with the briefcase, completely terrified of looking foolish in front of you, this seasoned expert. This makes your empathy, literally right from day one, absolutely non-negotiable. So how do we fix this? That brings us to section 2, pedagogy versus andragogy. To overcome that deep-seated fear we just talked about, we have to drastically shift our teaching methods away from how we were taught in grade school. In pedagogy, which is the study of how we teach children, the teacher holds all the cards. Think of a traditional lecture where you just stand at the front and talk at them for an hour about human anatomy while they passively take notes. But with andragogy, how we teach adults, it's more like a puzzle you solve together. The learner's in control. Active participation is required. Instead of lecturing, you're facilitating. You're asking them how they would approach a patient's bed, treating them as active, respected partners in the process, rather than just empty vessels waiting to be filled up with facts. Andragogy is formally defined as the art and science of adult learning. A researcher named Malcolm Knowles really developed this back in the 1970s. He realized something absolutely critical. Adults are not just oversized children. Traditional pedagogical models were actively failing adults because fully grown learners absorb, process, and retain information in a fundamentally different, highly complex way that requires mutual respect. So here is the crucial, provocative question you have to ask yourself every single time you step into that clinical lab. Are you teaching your students like children or like adults? Because if you treat them like children, they are going to shut down. But if you treat them like capable adults, you will completely unlock their potential. Moving right along to section 3, let's look at the characteristics of adult learners. Knowles identified 5 distinct traits your students walk in the door with. As adults, their self-concept has shifted. They identify as being responsible for their own lives, meaning they absolutely do not want to be micromanaged. They are self-directed. They also have a deep readiness to learn, but, and this is a big but, only if they understand exactly why the time investment matters to their immediate lives before they even start studying. And here's where one of the biggest mistakes happens: ignoring a student's past. Let's think back to our hypothetical student, Sarah. Say she spent the last 5 years caring for an ailing parent at home before she enrolled in your course. She is not a blank slate. She already intimately understands human dignity, empathy, and immense patience. If you treat her like she knows nothing, you're going to lose her. You have to acknowledge and purposefully build upon that massive life experience she brings into your lab. Furthermore, adult learners are completely problem-centered. If you give a boring, isolated lecture on the microbiology of pathogens,
I guarantee their eyes will glaze over. But if you frame hand hygiene as a high-stakes, real-world scenario, say a severe C. diff outbreak on their future floor that directly threatens vulnerable patients and their hard-earned CNA license, boom, you have their undivided, laser-focused attention. You've attached the theory to a problem they actively want to solve.
Let's shift into Section 4, factors affecting adult learning, because even the most beautifully designed lesson will fail if you ignore what's happening outside the classroom. We have to talk about the immense invisible baggage your learners carry: time, confidence, motivation, learning styles, stress, and emotions. We so often forget that these adult students aren't just going home to a quiet desk with nothing to do but study. Think of Sarah again. She's managing a chaotic household, she's probably working night shifts, battling crushing financial stress, and often fighting the very real ghost of past academic failures constantly whispering that she just isn't smart enough to be there. To help them push that massive boulder up the hill, you have to uncover their intrinsic why. Sure, a potential pay raise is a nice external factor, but you provide the real gasoline for their engine when you discover their deep, internal motivations. Maybe they want to prove to their kids that it's never too late to learn, or maybe they want to finally achieve true financial independence. When you link a really tough clinical skill back to that deeply personal goal, they will move mountains to succeed. As an instructor, the Skills Lab is honestly your greatest weapon against these learning barriers because it naturally caters to everyone. Visual learners get to watch your expert demonstrations of a complex patient transfer. Auditory learners listen to your precise step-by-step safety cues. And kinesthetic learners actually get their hands on the gait belt and physically do the work. You have to purposefully cycle through all three styles to ensure literally no one is left behind. Understanding all of these barriers brings us to our final and most important point, Section 5, building psychological safety. Now, psychological safety is not some soft corporate HR buzzword. It is a strict performance requirement in your lab. An adult dealing with a sick child at home or the sheer terror of academic failure literally cannot process your clinical instructions unless you intentionally create a safe culture. So how do you actually do that? Well, you purposefully make it safe to struggle. You share stories of your own mistakes as a new RN, like, the time you accidentally broke a sterile field. You actively celebrate questions instead of acting annoyed by them. You create an environment where a wrong answer is treated as a necessary stepping stone to mastery, not a fundamental character flaw. Let's think back to our adult literacy student's profound realization from earlier. He realized something completely life-changing. The person who knew more words wasn't fundamentally smarter or genetically superior to him. They just had the safe opportunity and the time to memorize more words. Learning is not about innate brilliance. It is entirely about having a safe, structured place to acquire the necessary tools without the crushing weight of judgment. Because when you step into this instructor role, you aren't just teaching them how to take a pulse or make an occupied bed anymore. You are entirely reshaping how these adult learners view their own potential in the world. So I want to leave you with this final, provocative thought. How will you actively dismantle their fear of failure in your lab today? Keep that front of mind the next time you step up to teach. Thank you so much for joining me for this explainer, and I will see you next time.